Hello, everyone. First of all, thank you for having me to attend this conference. Thank you for inviting me to share my research in this conference. Okay, before I start this presentation, let me just to give a very brief introduction about myself. I'm Prof. Liew from UCL Cyberjaya, Malaysia. My area will be on the probiotics, oral advanced drug resistance like the ODF, ODT, nanotechnology, nanoparticles, liposomes, numeric nanoparticles, and cosmeceutics. So today I picked this topic on probiotics to share with all of you on the advance in the oral dosage form. So the title of my presentation will be Probiotics in Oral Dispersible Film, Advanced Oral Microbiome Modulation for Oral Health and Nurse. If we look at the probiotics, the oral health is something that which is an unmet needs in nowadays global situation. We are always talking about the gut health, the GIT health, the mental health, and then we talk about the entire immune systems. But for oral health, normally we seldom pay attention to this area, and there's also not many much health supplements in terms of oral health. So if you are asked to define oral health is defined as a state of being free from chronic mouth and facial pain, oral and throat cancer, oral infection and sores, periodontal gum disease, tooth decay, tooth loss, and other diseases and disorders that limit an individual capacity in biting, chewing, smelling, speaking, and psychosocial well-being. So basically, oral health is just not about the mouth, but it's about the entire body. Because when somebody's having a toothache, a tooth pain, this will definitely affect the entire facial pain and then affect the entire well-being of that patient. Based on the study, 23% of people claim that the most important aspect influencing their quality of life was whether their teeth affected their ability to eat. Eating is something very, very important. When somebody has having a toothache, having a tooth decay issue, so this will affect the ability to eat. And when somebody has not eaten enough food, surely the mood also will be affected. 8% of respondents underline the significance of dental health in enhancing confidence. When somebody has a tooth decay, definitely this person will not have confidence to smile, even to open the mouth, to smile. This person will feel lack of confidence. 17% of respondents emphasize the value of oral health in providing comfort. And based on the other statistics in 2017, there were 3.5 billion cases of oral diseases worldwide with severe periodontitis, accounting for 796 million caries in permanent teeth for 3.3 billion, caries in dentitions teeth for 522 million, total tooth loss for 267 million, and other oral diseases for 139 million. So as you can see here that the mouth disease, oral disease actually affecting many globally. First, this is the stages of tooth decay. On the most left-hand side, this is a healthy tooth, yeah, a tooth which is healthy. And then if we are not taking good care of our teeth, what will happen is that the bacteria, as you start to make animal to decay, start to erode. So acid wears out the surface of the animal. And then when this continue on, becoming more serious, the erosion start to happen and then go into the dentin area. And the dentin also affected. And at this stage, the person will start to feel the pain. If this continue to deteriorate, continue to become more serious, there will be decay in the plaque area, and this will cause a very painful segmentation and eventually causing a bad tooth. So this is how the oral disease progress from healthy teeth and down to a very advanced periodontitis disease. If you look at the oral environment, the mouth environment, basically there is some microorganism that stay in the oral environment, and this is called the oral microbiome. Consists of the virus, the bacteria, the fungus, also and others. So in a normal and also healthy oral the mouth, There's a balance in terms of the healthy microbiome, and this situation is called a eubiosis. That there's a balance, and we have good bacteria, and we might have some pathogenic bacteria um, some of the time. But if we do not take care of our oral health well, this will switch to another imbalance that causing an unbalanced microbiome, or we call it the dysbiosis situation. So the oral microbiome is actually very important that many people that seldom pay attention to. Of course, we brush our teeth. Of course, some of us, we practice rinsing the mouth after each meal. But there is something that called the microbiome ecosystem in the mouth that many times that people seldom pay attention to. And in order to maintain teeth health, basically we need to maintain the good oral cavity health. If not, bacteria will start to grow in it, and then biofilm will start to develop some pathogenic species such as the S mutants, the P. individualis. All these bacteria that will start to um, grow in the oral cavity and then causing the teeth and gum issues. So the key message here will be oral diseases are fundamentally ecological imbalances, not just infection. Infection is something that we see as a consequence. Okay, but in order to prevent that, we do not just we do not just after we get an infection, then we heal the infection, but we need to balance the microbiome in the oral cavity. Okay, the limitation of the current therapy. When you go to see a dentist, then what they will offer you will be give you antimicrobial mouthwash, to give you some mechanical removal, ask you to do the scaling, ask you to do the brushing. Okay, these are the conventional strategy. But the limitation is that this is just to kill the microorganism. When you kill the microorganism, there might be tendency that you're killing both the good and also the bacteria. That causing there's an unbalance in the beneficial flora that grow in the oral cavity. And the key message here, many times we are just treating the symptoms, but not restoring the microbiome balance. When we talk about antimicrobial mouthwash or brushing the teeth, all these are just treating the symptom or just preventing. But maintaining a healthy environment for the microbiome to grow in the oral cavity is still very important. So now, this leads to our discussion here on the probiotics. According to the World Health Organization, WHO, and the Food Agricultural Organization of the United Nations, probiotics are defined as a living microorganism that, when administered in adequate amount, confer benefits to host health. Probiotic is also a type of bacteria, just that we term it as a good bacteria because when we consume it at the right amount, this will give us some benefit. Probiotics is able to serve as bacterial therapy due to its inhibitory effect on the oral pathogen, reversing the imbalance in oral ecological equilibrium and lowering the damaging characteristic of pathogenic bacteria while altering the real composition of the disease area to a more benign environment, spontaneously colonizing the oral cavity. So in this type of therapy, we are actually basically to use the good bacteria to fight against another pathogenic bacteria so that we strike a balance and then to reduce the effect of the pathogenic bacteria. And there are many types of probiotics, but there's a newer type of category of probiotics which is called the bacillus. It's gaining attention now because these bacillus coagulant, they are lactic acid forming gram-positive bacteria, facultatively anaerobic and neutral bacteria with the capability to generate spores. They are extremely resistant to harsh environmental conditions. They are more stable compared to the lactobacillus strain. So this is why Bacillus coagulans has been used as a um, probiotic strain to maintain health, not just the GI tract, but also the oral now. Probiotic as oral bacterial therapy mechanism in oral health, competitive adhesion to oral surfaces. So they will compete with the pathogenic bacteria to adhere on the oral surface, and then they will grow, they culture them. And then production of bacteria seems to inhibit other pathogenic bacteria, modulate the pH so that achieve a more balanced pH between the acid and base in the mouth, and also to strengthen the overall immune system. So these are some potential probiotic strain that some characteristic that they should have. They should be they should be able to stand against harsh environments such as the gastric acid, and they should colonize or grow in the lower intestine. They should not have any pathogenic, poisonous, or mutagenic effect on the host. They should withstand cold, freezing temperature. This is for the handling part, so that when we produce the product, this bacteria will not die easily. Should not negatively affect sensory properties of the food as well. To the next generation probiotics in dentistry. And we believe that the Bacillus coagulant will be one of the candidates here as used as the next generation probiotics in the dentistry area due to their high stability. They can survive high heats, storage, processing. This will give them an extra benefits of during the processing that they are not easily die during the processing, manufacturing procedure. They have longer shelf life versus lactobacillus, and they have also demonstrated very strong antipathogenic and biofilm modulation activity. Okay, now we have a good candidate of probiotic, but the main thing is that so we need an effective delivery system to deliver this probiotic so that this probiotic will not just directly go into the gut system, but it will stay in the mouth. So we will need something that have a longer retention time, that the product will disintegrate, will have a longer period of time in the oral cavity, so that there's sufficient time for the probiotic to stick on the oral cavity, on the surface of oral cavity, and something which can help to improve the patient's compliance. So this delivery system should be something which is user-friendly, consumer-friendly, and they find it easy to take. And our whole solution will be the oral dispersible film, ODF. Some benefit of the ODF, like very fast disintegration in the mouth, direct mucosa contact, because you put the fluid in the mouth and then let the fluid to disintegrate slowly in the mouth, improve the BA, and this is ideal for all patient group because you don't need water to swallow this, unlike a tablet. ODF is just a thin film that easily disintegrate in the mouth, so it's a very good and also easy to use for all types of patients. So what is ODF? ODF defined by the European Pharmacopoeia. ODF are defined as single or multi-layer sheets of suitable material replaced in the mouth where they disperse rapidly. Provide an alternative for patient use who struggle with swallowing, dysphagia, or choking anxiety, which can interfere with therapy and make patients' compliance and adherence more challenging. So if we formulate the probiotics into a liquid form, let's say a juice form, okay, patient will just drink and then just swallow it, and then there's no long retention time of the probiotics in the oral cavity. If you put it into a powder or whatever, a capsule or tablet form, also the patient have to swallow it. So there's a shorter retention time compared to ODF, which we put in the mouth and then it disintegrate. It might take at least maybe one or 2 seconds. So this is the sufficient time for the bacteria to stick on the oral surface. Objective of study, we have developed a probiotic films. It's called Sibinok, which is a ODF that with Bacillus coagulans and with prebiotics in the oral health. These are the materials. The carpamol and the sodium alginate, these are the two main film-forming polymers to form the film. Rhizobin is the plasticizer. The probiotic, the active strain will be the Bacillus coagulans. And then the prebiotic, because we are using a living thing. So when we're using a living thing as active ingredient, we will need the food provided for the Bacillus. And we are comparing maltodextrin, isomalt, xylitol, sucrose as prebiotic for the probiotic to survive for a longer period of time. So for the optimization part, we have actually developed different three ratios for each one, right? 1:3, 1:6, and 1:9 probiotic to prebiotic ratio for each of these prebiotic, maltodextrin, isomalt, xylitol, and sucrose, to see which one will form the best appearance for them, and also which one will give us a better shelf life, better viability. So this is the short procedure that the polymer, solvent, plasticizer, prebiotic, all these are in a beaker and then heated up to 70 degrees Celsius and then stir, dissolve all. And after all dissolved, we leave it to cool down to room temperature. And then at this time, the Bacillus coagulans was poured into this polymeric solution. And then this solution was cast into a mold. and then freeze dry for 24 hours at -50 degrees Celsius. So after it dries, a film will be formed and we cut it and peel it and cut it into the desired size and shape. So these are the tests that we have conducted to test on the film: physical appearance, viability, the weight variation, uniformity of thickness, in vitro disintegration time, folding endurance, pH test, tensile strength, young modulus, and elongation at work. So these are the appearance of all the film. As you can see, M1, M2, and M3. These three films actually give us the best appearance. White color is uniform, it's not too thick, not too thin, it's just an optimum size to handle. Compared to the sucrose series. Sucrose series S1, S2, and S3, as you can see here, it's not totally uniform. You can still see many pores, many which seem transparent. The X1 and X2 using the xylitol, which the situation is even worse compared to the sucrose now. You see more pores, more transparent parts. I1 and I2, these are the isomorphs, which is not very uniform, the texture. So you can see here, some part is less thick, is thinner, some part more white, which is thicker. Okay, comparing the appearance, whether it's easy to be peel off, we notice that the maltodextrin series of one country, this is the series that with the best peeling off effect, and it's not brittle, so it's a strong film. So comparing the viability, viability is very important here because of the viability will determine how long and also how much the bacteria can actually move. So this is the scale of 10 to the power of 12. And in Malaysia, there is a requirement that all the product be maintain at least 10 to the power of 6 CFU per mil. So all the population pass this test because or they achieve 10 to the power of 12. Okay, the weight variation, it shows that the weight is consistent among the population. The thickness, when we increase the ingredient, there's a slight increase in the thickness. Average disintegration time. M1 and M1 and M3, these are this is actually the price series. Basically, all the films developed are actually less than 180 seconds. Because for ODF, there is actually a requirement that the film should disintegrate in 3 minutes. So all the films here disintegrate within 3 minutes. Folding endurance also can be folded more than 100 times, which shows that all these films are flexible. pH, okay, all are within 5 to 6 point something. Okay, this is the optimum pH for the oral cavity. Tensile strength, so the formations shows that they have enough tensile strength here. Elongation. So for the optimal formulation, we determine M1 as our best formula, which consists of the ratio of 1 to 3, probiotic to prebiotic, auto extreme. Okay, so these are the MG, the among use. So basically, this film is a smooth mud film with a 5.4 times 10 to the power of 12 CFP per mil, day 28. So far, we have tested up to 3 months and it is still stable. The disintegration time is 5.23, just 1 minute plus. It's a very thin film, very lightweight film with pH of 5.6, still acceptable. Cooling endurance of more than 100 times. The moisture content between 4.01 to 5.42. This is a SCM image because due to the freeze drying process, we freeze the film, so the film become ice, and then using the vacuum to suck out the water molecule. So when the water molecule leaves the surface of the film, it leaves some pores. So this makes that the water can penetrate into the film easily, disintegrate the film. So we have actually sent our product. This is our product. We call it as the Symbimoc, and yeah, we sent to competitions such as MTE and won some medals. We also sent to the VICE 25 and won a gold medal, Young and Loiter gold medal. Okay, this is my information for collaboration. If you are interested to know more about this study or to have a collaboration, feel free to contact me. This is my email address and also this is my Instagram, which you can follow. Okay, I think that's all from me. Thank you very much for your attention. Thank you very much for listening to this. And I hope to see some of you, hope to collaborate with some of you in near future. Thank you.